Hello, this is Roktim Banerjee, and today we will be discussing a cranial nerve, which is 8th cranial nerve, and this is the vestibulocochlear nerve. Now, to discuss this topic, at the end of the session, we must know, or our objectives today will be to know just an overview of this nerve, what is its superficial origin, location of the nucleus of this nerve, 8th cranial nerve, what are the functional components, what would be the central connections, little bit about its course, distribution, communications, and some applied aspects. So, to look into the overview, this is the 8th cranial nerve, and as the cranial nerves, 12 cranial nerves we have, these roughly follows a division of 4 cranial nerves usually related to the midbrain, then next 4 is pons, the next 4, that is 8 to 12, is related to medulla. So we expect that the 8th cranial nerve will be somewhere in the upper part of the medulla. So the superficial attachment is at the junction of the pons and medulla, that is the pontomedullary junction. And as the name implies, this is the vestibulocochlear nerve. And this vestibulocochlear nerve has got 2 components. One is the vestibular component, which is related to equilibrium and balance, and another is the cochlear component, which is meant for hearing. Now, if you see this picture, this is taken from the Gray's Anatomy. We can find the different cranial nerves at the base of the brain, as if we are looking the under surface of the brain, and the parts of the brainstem is visible from above downwards. That is midbrain, pons and medulla. We can see the nicely bulged structure, that is the bridge or pons, and then it is the medulla, and nerve, vestibulocochlear nerve along with the facial nerve is visible at the pontomedullary junction. Now, if we look into the overall relation of this nerve's nuclei in relation to the brainstem, we can find that it is very nicely related to the floor of the 4th ventricle, and this nerve, as the name implies, it has got vestibulocochlear component, that is the vestibular and cochlear component has got its separate nuclei for its relay. Now, vestibular component, it is present in the floor of the 4th ventricle, along with the cochlear component, which is more laterally placed. There are subdivisions of the vestibular component, superior, inferior, medial, lateral, in that way. Cochlear nerve nuclei, it has got a dorsal and a ventral cochlear nucleus present, which is in relation to the floor of the 4th ventricle. Now, if we just try to know that this vestibulocochlear nerve is intimately should be discussed with the inner ear, and the inner ear, which is meant for maintaining the balance, as well as it is the organ for hearing, a special sense. Now, this arrangement, that is the inner ear, it is present within the bony petrous part of the temporal bone. That is, the petrous temporal bone accommodates the inner ear. This inner ear has got 2 portions. One portion is meant for hearing, which is the cochlea. The cochlea turns a spiraling tubular arrangement. Then this cochlea, it is related to a cavity which is termed as vestibule, and finally there are 3 canals, the semicircular canals. They are attached together and they are spatially oriented in a 3-dimensional location that can be meant for sensing the position of the head, this rotational movement of the head, so that is maintaining the body's posture. So now, how this hearing mechanism and the balance is related to the ear as a whole. Now we can see the pinna in the left side. Then the pinna, as the hearing mechanism, it receives the sound waves. Then it rather drives or guides the sound waves to travel along the external acoustic meatus. Then it goes into a closed, thin membranous end, which is a tympanic membrane, a round structure like a diaphragm, and as the sound wave confronts this diaphragm, then this diaphragm or the tympanic membrane vibrates. This vibration, this sound wave, this vibration is transmitted with the help of three small ear ossicles. From outside inwards, they are malleus, incus, and then stapes. Stapes has got a footplate which is fitted with an annular tendinous arrangement with the fenestra vestibuli, and this fenestra vestibuli is transmitting this sound wave, this converting into a vibration, and this vibration will be transmitted to the deeper structure which is lying below or deeper to the footplate of stapes. I repeat, the sound wave when confronts the tympanic membrane vibrates. Along with the tympanic membrane, ear ossicles, malleus, incus, and stapes vibrates. Footplate of stapes when vibrate, it transmits this oscillation into the fluid just below it. This fluid is a fluid-filled bony cochlea or bony inner ear structure, the bony labyrinth. Within this bony labyrinth, this perilymph, as it vibrates, this vibration will be transmitted into the cochlear canal, and finally, in the organ of Corti, the basilar membrane will be vibrating, and this basilar membrane, as it will be vibrating, it will be vibrating its sensory cells, hair cells, and this hair cells is related to a gelatinous membrana tecturea that causes bending of the hair cell, which generates the action potential to originate, and this action potential is transmitted via the cochlear nerve. This cochlear nerve, when it is receiving this action potential, they will be carrying this action potential into the ganglion. As the spiral organ of Corti is related to the ganglion, the name of the ganglion, which is placed within the bony modulus, is termed as spiral ganglion. Then from the spiral ganglion, the nerve rootlets, and when multiple nerve rootlets are collected, they are coming out through the modulus in an arranged fashion, which is the perforations are named as tractus spiralis foraminosus, and this modulus and this tractus spiralis foraminosus is exiting the cochlear nerve rootlets through the inner ear, and along with the vestibular nerve, it will be going towards the pontomedullary junction, towards the vestibular and cochlear nerve nuclei. Now, this is the hearing portion. The balance portion, there are specialized patches of epithelium that is present in regions, namely utricle and saccule. They are meant for the static equilibrium and for kinetic equilibrium, that means the rotational movement, head bending. These movements are sensed by specialized regions in the bulging at the beginning of the semicircular canals in one side. These are termed as ampulla, and these specialized areas are termed as ampullary crest. Again, hair cells are present in maculae of utricle and saccule and the ampullary crest, and along with this there are gelatinous substances with some differences in between the maculae and ampullary crest. They will finally sense the movement, the change of the hair cells, and that will generate the action potentials, and finally the vestibular nerve will emerge, they will come out, and they will again relay into the vestibular ganglion, or termed as Karp's ganglion, just at the bottom of the internal acoustic meatus. Then finally these nerves, vestibular nerve, cochlear nerve, along with the facial nerve, they take the passage to the internal acoustic meatus. So that is the arrangement. Now if we look another diagram, it is the base of the brain. We are looking from above, and in the left side, over the bony part of the petrous temporal bone, inner ear, how it is located, we can plot. The purple structure is the cavity, which is the middle ear cavity. Then anteriorly it is going towards the pharyngeal cavity as a pharyngotympanic tube. Then you can find anteriorly the turns of cochlea that emerges the cochlear nerve through the tractus spiralis foraminosus. The yellow structure is nothing but the facial nerve. It takes a bend. This is the first genu of the facial nerve. Then it will take another bend, the second genu of the facial nerve. It's not our discussion today. And we can find that the cochlea is connected with a bony cavity, which is the vestibule, and vestibule is connected with the semicircular canals. Within this bony labyrinth, we can find the membranous labyrinth. Membranous labyrinth is floating into a fluid which is perilymph. These are ultrafiltrate of blood plasma, and as well as it is a part of cerebrospinal fluid. There is a turnover of the cerebrospinal fluid through the ductus and saccus endolymphaticus. We'll come into that. So if we see into the structure which is present within the bony cochlea, this bony labyrinthal part, this is a membranous labyrinth. We can find in the left side, this is the turns of cochlea. Within this cochlea, in this cochlear duct, that accommodates the spiral organ of Corti. The spiral organ of Corti is communicated. These are intercommunicating channels. These are intercommunicating channels. They are communicating with the vestibule, and within this vestibule, we have a sac termed as saccule, which is connected with the saccus endolymphaticus through a duct system. There is a efficient duct system, and this saccule finally, which is when it is communicating with the utricle through a utricular saccular duct, this utricle is communicating, is a common chamber, is communicating with the semicircular canals, and one end of the semicircular canal is dilated, termed as ampulla, and within the ampulla, the patch of specialized cells that forms the ampullary crest, which will be responsible for sensing the rotational movement of the head, the position of the body, is that way. Now this cochlea in recent state, this portion which is termed as fenestra vestibuli is covered by the footplate of stapes, and the fenestra cochleae is covered in recent state by a trilaminar membrane, the secondary tympanic membrane. Now coming to the functional components of the vestibular nerve. Vestibular nerve, they possess the special proprioceptive fibers meant for static equilibrium. The arrangement of cells are from the hair cells of the maculae of saccule and utricle. Special proprioceptive fibers for kinetic equilibrium, these are from the hair cells of ampullary crest of the semicircular canals. Few different fibers of olivocochlear bundle is present, and they modulate the degree of excitability by inhibition. There is a control mechanism. Now, going to this diagram, on the left side we have the ampullary crest of semicircular canal. They are meant for rotational movements, and in the right side, this is the otolith organ of maculae of saccule and utricle. This maculae of saccule and utricle and the ampullary crest are more or less same, but there are some differences. Both of them possess hair cells, but maculae of saccule and utricle, as they sense the gravitational pull, this arrangement is having some calcium carbonate crystals, calcites. Okay, so these are, when gravitational pull is there, this movement and the hair cells which are embedded within this cupola, this otolithic membrane, they now, when brain, they senses the gravitational change, sometimes acceleration and deceleration when in the car. These movements are sensed, and this incites, this evokes action potential, and that is carried by the vestibular nerve. Now in the left side, when we can see the ampullary crest of semicircular canals, the cupola, this gelatinous mass, doesn't possess any calcites. No calcium carbonate crystals are present here. Now hair cells are embedded, but as movement, rotational movements are there, the fluidic movement of the cupola, that bends the hair cells, and that evolves some action potential in the hair cells, and that is finally sensed, or this action potential is carried through the nerves, vestibular nerve. Now about some afferent fiber cells of origin. The static and kinetic equilibrium is carried by the bipolar neurons of the vestibular ganglion. It's the Scarpa's ganglion. This ganglion is situated at the trunk of the vestibular nerve at the bottom of internal acoustic meatus. Efferent fibers. The fibers arise from the superior and accessory olivary nuclei of the pons. Both ipsilateral and contralateral communications are there, and vestibular and cochlear communications are also there. There the vestibulocochlear anastomosis is present, is described. Now, if we discuss the peripheral distribution of vestibular nerve, what we can find, there are upper branches which traverses through the superior vestibular area to reach the maculae of utricle and ampullary crest of anterior and lateral semicircular ducts. Lower branches, the inferior vestibular area, they reach maculae of saccule. Posterior branch, they traverse through foramen cingulare. They reach the posterior branch through the foramen cingulare, reach ampullary crest of posterior semicircular canal. Now, if we look into the diagram of this internal acoustic meatus, to the left side is marked as anterior, to the right side this is marked as posterior. Now, this is not visible normally. What we can find, we can find a single opening in the petrous part of the temporal bone, that is the internal acoustic meatus. Now, if we cut this portion of the bone, then we can find a transverse crest divides this internal acoustic meatus into superior and inferior half. In the superior half, anterior and posterior is demarcated by different areas. Now, in the anterior, there is a single passage which is the passage for facial nerve. In the posterior and superiorly, it is the superior vestibular area. Posteriorly and inferiorly, it is the area for inferior vestibular nerve and a foramen cingulare which is meant for posterior semicircular canal. Now, anterior to the inferior vestibular area, this area has got multiple fenestrations, and this multiple perforated arrangement is termed as tractus spiralis foraminosus, which is nothing but the face of the modulus through which the cochlear nerve rootlets are coming out from the cochlear duct. That is the arrangement. Now, if we see the central communications of vestibular nerve, the central processes of bipolar ganglion cells, they reach the vestibular nuclei and then to the flocculonodular lobe of cerebellum. So, what happens? The first order neuron cell bodies are located in the Scarpa's ganglion or the vestibular ganglion. Peripheral process goes towards the peripheral organ, that is the inner ear. Central process go to the vestibular nuclei, and then it will be going towards the flocculonodular lobe of cerebellum, then other areas too. Now, we see the ampullary crest, saccule, utricle. From here, peripheral fibers of the vestibular nerve, the first order neuron, they go towards the vestibular ganglion. From the vestibular ganglion, it is the central processes that is communicating with the vestibular nuclei. Now, if we see the vestibular nuclei, it is the vestibular ganglion to vestibular nuclei. Then the fibers will be traveling in different way. The major portion, they will be going through the inferior cerebellar peduncle to the cerebellum. Then there are communications via thalamus to the cerebral cortex, another communication. Then a few fibers go to the medial longitudinal fasciculus. Finally, it is communicating with other areas of the brain, and some communications to the vestibulospinal tract from the lateral vestibular nucleus. So these are the central communication. The pathway, we can see the vestibular nerve which traverses from the vestibular ganglion to the central vestibular nuclei to its superior connections. Now, if we go to the functional component of the cochlear nerve, then we can find that special somatic afferent is present here also, the hair cells from the organ of Corti. efferent fibers from the olivocochlear bundle. These efferent fibers from the olivocochlear bundle, basically they are protective in nature. They modulate the degree of excitability. They protect the hair cell from loud sound. There are different mechanisms, say tensor tympani muscle, say stapedius muscle. These neural connections, when will be supplying this muscle, the stapedius will be taut, so that stapes movement will be less. So that is a protective mechanism to protect the ear from the loud sound. Now, if you see the organ of Corti is often a short note or a part of a long question. There we can find the inner hair cell, outer hair cell, some supporting cells. Now what happens? These cells, they lie on a membrane, the basilar membrane. Now, which are connected with the bony lip. This bony lip is coming or spiraling through the modulus, and this lip, which is the passage for the cochlear nerve to reach the sensory cells, there is a hair cells. Now these cells originate from the bipolar ganglion cells, has got two arms. One is going to the periphery, the peripheral portion, and this connection or the central connection will be going towards the cochlear nuclei. Now what happens? The fibers ramify around the bases of the inner and outer hair cells. There are some numbers. Each inner hair cell receives, say, 10 ganglion cells. One ganglion cell finally connects to more than 10 outer hair cells. In that way, there are connections. Now, what are the central connections? From the ganglion, central processes, they pass through the tractus spiralis foraminosus, and they relay with the dorsal and ventral cochlear nuclei. I repeat, from the tractus spiralis foraminosus, the central connections come out. They relay in the dorsal and ventral cochlear nuclei. Now, if we see this diagram, there is dorsal and ventral cochlear nuclei. They receive the central connections from the spiral ganglion. From here, the fibers, the second order neuron, they go towards the nucleus of olive, the superior olivary nucleus, and posterior nucleus of trapezoid body, the nucleus of trapezoid body. Now, what is trapezoid body? When these fibers intercommunicate, there is ipsilateral and contralateral communications of all these fibers. When there is a cross section, these intercommunicating fibers at this level, they take a shape of a trapezium. So that's why this is termed as trapezoid body. Now, from the trapezoid body, discrete fiber bundles, thin, compressed, quite conspicuous fiber bundle like a cable, they communicate superiorly with the inferior colliculus of midbrain. This is termed as lateral lemniscus. This fiber bundle, which is compressed, conspicuous compressed band, is termed as lemniscus. Amongst the lemniscal system, this is termed as lateral lemniscus. Now, the important feature is within the lateral lemniscus, there are arrangement of relay system. This relay system often they form nucleus of lateral lemniscus. Now, what happens then? First order neuron terminates in cochlear nuclei. Second order neuron terminates in superior olivary nuclei or nuclei of trapezoid body. From here, second order neuron from cochlear nucleus to either posterior nucleus of trapezoid body or the superior olivary nucleus terminate. Third order neuron starts from here and go towards the inferior colliculus. If it relays in between in the lateral lemniscus, then another order neuron increases, say it is third order, then finally fourth order. Fourth order neuron to fifth order neuron will be going towards the medial geniculate body, and from there auditory cortex of the superior temporal gyrus or the Heschl's gyrus, it is termed as Heschl's gyrus. So this is quite unique for lateral lemniscal or the auditory pathway, that it has got more than third order neuron, maybe fourth, fifth order neurons, maybe even confronted. So that is a very unique feature in contrast to other areas where usually three orders of neurons are present: first order, second order, to finally third order neurons with central destinations. Auditory system has got more than three orders, fourth, maybe fifth order neurons are present. Now, nucleus of lateral lemniscus, inferior colliculus of midbrain, they often communicate with contralateral nuclei. So what happens, what is the importance of that, that if it is communicating with the contralateral nuclei, so one fiber bundle, if it is damaged in one side, usually the higher centers often receives the information from opposite side, and the loss is maybe sometimes less. So that is one explanation that is the contralateral communications are working as a protective phenomenon, or we can say the compensatory phenomenon. So that is the arrangement or the pathway of the auditory system, what you can see. So this is all about the vestibulocochlear nerve. This is the 8th cranial nerve. Special afferents, somatic afferents are there. Then it has got two components, one for the balance, one for the hearing. Peripheral connections, neural connections, the nuclei, the pathway in short discussion. Then going to the applied aspects, if we consider the hearing aspect, we can have the sensory neural deafness. Sensory neural deafness can be of having different etiologies. Then we can have some tumors, say tumor in cerebellopontine angles. They can present as sensory neural deafness, or maybe tinnitus, buzzing sound. If there is a fluidic pressure changes, say in Meniere's disease, which is termed as endolymphatic hydrops, Meniere's disease, then if some otolithic organ, if there is some minute changes that can incite vertigo, there are different investigation processes for sensory neural deafness, say tuning fork test, for using machines like audiometry. We can assess the vestibular functions through caloric test. Other tests are also available here, more finer tests. Vestibular dysfunctions can be present, like say vertigo and balance disorder. Patient may present with different nystagmus, different intensities of vertigo, maybe nausea, vomiting is also present with that. So that is the applied aspects related to 8th cranial nerve. So overall, this is the discussion. MRI scan showing cerebellopontine angle tumor, CP angle tumor. This white structure is the tumor in that region. So that is more or less all regarding the cranial nerve, this discussion. Suggested reading is textbook of neuroanatomy. Thank you very much.